All right, good morning. My name's Nikki. I've been seeing Dr. Hagmeyer for, I think it's about 7 months now. And I kind of came here very hopeful, but also kind of at my wit's end with where I was. I had heard about Dr. Hagmeyer through a friend and heard about some kind of out there nutritional and kind of things, and it was interesting because I've suffered from a lot of food sensitivities and kind of health issues for a long time. So I gave it a shot, and kind of the glimpse before I started all of this, I had gotten to a point where my diet was severely limited. I was kind of known as, amongst all my friends, as the one who couldn't eat anything.
What were you eating? What was the typical diet for you like when you first came in?
I ate a lot of eggs. It was interesting because I knew a lot of things I was sensitive to, but I didn't know what I could eat. Right. So I was always questioning what I was eating, if it was the right thing, if it was the wrong thing. Sure. So I had a pretty clean diet in the sense of not a lot of chemicals, no preservatives, no nuts, no seeds, but I was eating dairy, eggs, a lot of whole grain types of things. Turns out a lot of that wasn't what was healthy for me.
Well, we tested you, right? We did a whole bunch of
different
food
tests.
sensitivity testing where we looked at like gut permeability, things like leaky gut.
Yep.
Right? We looked at adrenal fatigue.
Yeah, that's the one thing that I totally appreciate about the whole program. It's very, I don't know if scientific's the right word, but very data-based, very objective, which is what I needed because I've been for so long trying to figure it out.
Sure.
And so on a daily basis, the food sensitivities were huge. I'd get a lot of reactions after I would eat in terms of not feeling well, being really tired, headaches. Day to day, the fatigue was awful. I could sleep all night, 9-10 hours, wake up, be tired, and fall asleep on the way to work.
Yeah. So that was a big issue for you. That was something that was kind of basically like it was affecting every aspect of your health, and it was basically, you didn't have any step or pep in your go.
I had nothing. And, I had gotten to the point where on a daily basis, if I didn't have an access to being able to lay down or take a nap in my car, I used to drive between places at work and hope for 20 extra minutes so I could sleep for a little bit before I'd go see a client or whatnot. So it was basically affecting. Now, I actually, if the alarm goes off in the morning, don't pray that I can sleep for another 10 minutes. I can get up, get out of bed. There's absolutely no fatigue. It's great.
What else? What other changes have you noticed since you've been under care? Because you had a lot of issues with asthma and a lot of issues with hives.
Yeah, I've had asthma off and on for a long time. At the time that I started, it was pretty bad. I was on 4 allergy medications. Which thankfully I'm off of all now.
You're off all of them?
All of them.
Awesome.
All of them. And haven't had any breathing issues or any hives for months now, really. The only time I do is if something sneaks into my diet and I can tell right away. And then if I take that out, it's gone.
Yeah.
So that's fabulous. I was literally having asthma attacks, breathing issues several times a day. And hives, I've had them off and on for most of my life. But I was having attacks for about 2 straight years of just having to take constant medication to not.
And so all those medications that we take, those all have impacts on the health of our body. And I think what a lot of people fail to realize is just what these medications are doing inside their body and really stopping their body from truly getting well. I mean, we kind of tend to think we're going to wake up and all of a sudden that one morning, all these pills that we're taking, it's going to be like that magic concoction that now all of a sudden starts working. And the functional medicine program that we basically started working with you on really looked at the neurology of the body and looked at the metabolic components of the body. And this functional medicine is something that's been around for a while, but I think people are starting to just really catch on to it because it really solves the health issues that people have, the chronic health problems. So I want to thank you for doing this testimony. What advice would you give to someone who maybe is at home and they're suffering and they are that person thinking that one day all these medications that they're taking is going to finally kick in? What would you say to somebody?
I would say, first of all, definitely call and get a sense for what you have to offer. Like I said, it was very helpful to me to have one place to go to because you were able to look at everything. I had doctor after doctor who would look at one component of it, but never really treated all of it. So I would definitely say give you a call.
Yeah, awesome.
And start to look into it, you know, and it starts to make a lot of sense when you start to put the pieces together
Sure.
about all of that. And that's the one thing that I'd say I really appreciate is that you've always taken a look at the whole picture,
Yeah.
never treated anything in isolation. There's always been a plan for how to address things, so I think it definitely, don't hesitate.
Awesome.
Can't hurt.
Thanks very much. I appreciate
You're
you
welcome.
doing this for us.
Absolutely.